Sub-Q IV push, 6/21/20, Millie Larson, January 1st, 1936. Medical record 123456, no known allergies. Check the new orders, assess patient at bedside, lungs, heart, level of consciousness, edema, circulation labs, vital signs, blood sugar, and if the patient was eating. I also did a knowledge check and see if the patient was going to be refusing the medication that the doctor had ordered. I also did some patient teaching and education on the Lasix and Humalog order, such as the possible side effects and what symptoms to look for related to the side effects, which is going to be hypotension, cardiac arrhythmia, hypoglycemia, hyponatremia. So I'm at my med cart. My med cart is locked. I start with documentation. I make sure my signature and my initial to indicate I am the nurse that administered the medication is at the bottom of the Mars. This is Millie Larson, January 1st, 1936, January 1st. Birth date's January 1st, 1936. Today's date is 6/21/20. Medical record number 123456, no known allergies. There's 3 checks required on the medication administration rights: the right drug, right dose, right time, right patient, right documentation, right reason, right knowledge, and right to refusal. The first drug is Lasix, 40 milligrams now, Q12 hours, flushed with 3 milliliters of normal saline before and after for edema and blood pressure. The second drug is Humalog, 10 units sub-Q with breakfast, now to control blood sugar. So there's my drug, my dose, my time, my patient. Documentation has already started, reason, knowledge, and right to refusal. So now I'm going to start with my Lasix. This is Lasix. This is a expiration date of 5/28. It's a single dose vial, so the top needs to be intact and on. And this is for IM. I check the concentration. It's for IM and IV use. I check for cracks, leaks, particles, and make sure it's well blended. The order is for 40 milligrams. This is a 10 milliliter vial with 100 milligrams of Lasix per milliliter, which I've calculated twice to come up with a 4 milliliter dose to equal 40 milligrams. The order is now Q12 hours, flushed with 3 milliliters of normal saline before and after related to edema and blood pressure. I've got a pre-assembled syringe with a it's a 5 milliliter syringe with a 22 gauge needle, 1.5 inch long. I've got two 10 milligrams of normal saline, of normal salines for my flush. So that's my supplies for my first, on my second check. The next one is Humalog. The expiration date is 10/27. This is a 10 milliliter, 100 units per milliliter in the vial. I've checked for cracks, leaks, particles, and blended. This is a multiple use. So all I need to really look at, if the top has been opened, is the date and initial when it's open, and make sure it's less than 20 days. On my calculations, I'm only going to need 10 units. I've calculated twice using a 1 milliliter with a 29 gauge needle with a 1/2 inch in length. And this is pre-assembled as well. So I've got my supplies for my second. I've got my 2x2, and I've got my my multiple packages of alcohol swabs. So I'm going to begin. My third check is putting it together. This is Lasix. I do 3 to 5 seconds at the top in a circular motion. I make sure that my safety is on the table and my vial's on the table. My bevel is up, and I'm going to go in at a 45 to 60 degree angle. Only the shaft will touch the rubber. The hub will not. I will inject my 4 milliliters of air. Once I inject my air, I will flip over and making sure that the bevel is above the fluid line when I'm injecting the air. I will withdraw my 4 cc's at eye level for accuracy and preciseness, tapping to make sure that there's no air in the syringe. So I withdraw and I recap my needle, maintaining an aseptic technique, using my pen as a barrier for movement to recap this for safety. So I've got Lasix, 40 milligrams, which is 4 milliliters in a vial of a syringe of um, 5 milliliters, to equal the 40 milligrams of Lasix that's due now. Q12 hours for a flush of 3 milliliters of normal salines before and after, related to edema and blood pressure. So there's my third check on my rates for Lasix. Here we go with the Humalog. I'm going to clean the top using the circular motion. I'm going to take my needle, maintaining aseptic technique, which is sterile, keeping the needle bevel sterile and the insides of the container sterile. I'm going to go at a 45 to a 60 degree angle. When the bevel passes the rubber, I'm going to go at 90. The hub will not touch the rubber, and I inject my 10 units of air while the bevel is above the fluid line. I withdraw my 10 cc's of fluid of the Humalog, and at eye level, I make sure that that's what that is, and I make sure there's no air by tapping on it. I recap by using my pen as a barrier of movement, using a one-handed technique. I put my cap back on. So my cap is back on, and my papers are all in the trash. This is, and I'm verifying again, Humalog, 10 units, sub-Q with breakfast, now to control blood sugar. So I'm ready to go into the patient's room, and I need to make sure that I throw the Lasix in the Sharps container. So I unlock my cart, knock on the door. The patient lets me come in. I clean my hands on the inside of the door, shut the door, pull the curtains. I'm an arm's length of the cart as well as the patient. The cart is locked. The bed is elevated at waist length. The side rails are down. The call light is removed. There's no obstacles for me. I've checked identification, the identity of the patient by looking at the band and the MARS and making sure that the date of birth and the patient's name is correct, which is Millie Larson, date of birth January 1st, 1936, medical record number 123456. Today's date is 6/21, and there's no known allergies. I've checked compatibility protocol on these drugs. I've checked to see if there's any reaction. I checked plasticity of the medication as well. So I'm going to start with my sub-Q. I'm going to taunt and not pinch the skin, which means I'm going to take my index finger and my thumb and spread them apart, creating a V. And in the center of that is where I will be injecting this solution. I will be inspecting the site for burns, birthmarks, inflammation, scars, lesions, vessels, nerves, abnormalities, bony providence. So I taunt the skin in a circular motion going out to clean the skin. I'm talking to the patient. The patient is in a position to where there is no muscle tension. They're comfortable. And talking to the patient, I go at a 90-degree angle, quick stick, while they breathe for me, and I take my non-dominant hand to take control of the syringe so that if the patient moves, I still have stability over it. I selected the abdominal area because you have several sites to pick from. I go in a nice smooth, and then I pull out my syringe in the same angle that and pull the safety up to create so that I do not damage any tissue. Dab the skin. I do not massage because I have to have an order for that. Again, there's several areas to go in. The abdomen, which is upper and lower on the right and left side, 2 inches horizontally and vertically from the ubiquitous, which is the umbilical cord, 1 inch from the last site, or making sure that the patient is not using heparin, and I would go somewhere else. I cannot use her upper adductoids because she is an older patient and there's loss of muscle tone. The anterior thigh and the buttocks are other areas that can be used, but again, the abdomen and arm have an even flow of absorption. Those are the better sites. So now the syringes form are 0.5, 0.3, 0.5, and 1 milligram. The needle sizes for sub-Q are 3/8 to 5/8. And the angle is 45 to 90. It depends on the site, the muscle tone, a pituitous tissue in order to avoid muscle. Also, the Luna depends on the blockicity, also known as the shaft, medication, and the speed of medication. The gauges are 25 to 30 gauges to decrease pain and decrease tissue trauma. And also you can use a 14 to 80 for blood or mixing of medication. So now I'm on the administration of my Lasix. So I'm going to clean the top of this for a minute. I've checked compatibility. A hep lock. I've got my non-dominant hand. I make sure that it's not clamped. I check the date for 72 hours, make sure the site is still good. There's no infiltration, no edema, no tenderness, no redness. It all looks good. The patient's not complaining of pain. She's not tense, not breathing. A hep lock is directly into the vein for immediate absorption. There is no room for error. This medication will irritate the wall, creating pain, abscess, and slough. So I clean the port for a minute, and I'm going to be watching the patient. This goes in the Sharps container, maintaining aseptic technique. And this is my first flush, but before I start flushing, I pull back to make sure that it is patent, and my non-dominant hand has control over this area. So I'll start my flush, and I will flush using 3 milliliters, which will leave only 7 milliliters in a 10 milliliter syringe. So there I go. I drop that in the Sharps container, and I will clean for a minute and 30 seconds. Again, as I'm giving this medication, I'm going to be watching before, after, and during for comfort, airway, oxygen, and a possible allergic reaction, fully aware of protocol. The needle goes in the Sharps container, and here I go. Lasix is recommended at given 1 minute per 20 milligrams. So I'm going to go in 2 increments of 1 minute, in 1 minute increments or 30-second increments, 1 milliliter at a time over a period of 2 minutes. So that's how I would push it. Again, I would push 4 milliliters over 4 increments, 30 seconds apiece, injecting 1 milliliter at a time, so that it's nice and slow, and I'm watching the patient and making sure there's no reaction, no infiltration, and everything is safe. So again, I will clean this for another minute, talking to the patient, making sure that the patient is comfortable, and I'm going to do my last flush of 3 cc's, 3 milliliters of normal saline. This is a 10 milliliter syringe, so after I've injected 3 milliliters, there will only be 7 left. I will do that nice, slow, and steady, monitoring the site and the stress of the patient. Everything looks good. So now I'm going to remove my gloves and clean my hands, and I'm going to document. I'm going to document the site, left lower quadrant. I'm going to document my blood sugar reading on my Mars. I'm going to be documenting if the patient refused, I'm going to initial my time, the time and that I gave it. I'm also going to make sure vital signs and lab works are correct. I'm going to make sure that the patient is comfortable before I'm leaving. I'm going to address any teaching issues, any teaching areas that need to be taught. I'm going to make sure that the bed is elevated. I'm going to make sure that the call light is back in reach. I'm going to make sure the side rails are up. I'm going to make sure the bed is lowered and the wheels are unlocked because they were locked prior to me beginning administration. And I'm going to answer any questions the patient has. And I'm going to take in consideration any new rises of conditions that could be a possible contraindicators for the administration of the medication. And I will